Hello, my name is Arnitra Hawkins, and I'm here to present my Capstone 5-year plan and presentation. The course I'm presenting this for is for 4580 Practicum Synthesis of Professional Nursing, Lamar University, Dr. Nancy McAfee, instructor. First, a little bit about myself. My name is Arnitra Hawkins. I am currently enrolled in Lamar University's Bachelor of Nursing program. I received my associate's degree of nursing from San Jacinto College in 2016. Since graduation, I have been employed in a skilled/long-term nursing care facility for adults and geriatrics as both a wound and charge nurse. Upon receiving my baccalaureate degree, my immediate goal is to shift from long-term care to orthopedics. My long-term goal is to continue my education and become a nurse practitioner with a focus on geriatric care. Thankfully, my hobbies include reading and writing, which I will probably take some time away from once school is completed. I also enjoy spending time with my family and friends. My hope is that after graduation, I will have opportunities to spend more time with them and simply enjoy the great accomplishment that awaits me at the end of this program. Lamar's RN to BSN program had several objectives that we wanted to accomplish. The first of those are humanity and society. The goal of this objective is to practice safe and effective, holistic, patient-centered care to a variety of patients or clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. A course that accomplished this objective for me was the Nursing 4550, Nursing Leadership and Management. This objective was addressed in a global PowerPoint focusing on the Therapeutic Touch International Association. This presentation allowed me to research the effectiveness of touch in a patient-centered environment and view how it is perceived globally. The course also gave students the opportunity to discuss via Blackboard nursing issues that have the potential to take away from patient-centered care and how we can overcome and or work through those issues with our team members both laterally and vertically. The next objective was Lifespan Health Continuum. The goal of this objective was twofold. The first was to support patients and clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. The second goal was to evaluate patient-centered care for patients or clients across the lifespan based on common and complex health needs and compromise multiple health states when considering multiple determinants of health. I accomplished this during Course 4316, Comprehensive Health Assessment, with the use of Shadow Health Comprehensive Self-Assessments program, which allowed students to virtually assess patients from children to adults. I chose to address the wellness promotion in a Healthy People 2020 objective paper that discussed how we, as medical professionals, can increase the ability of people over the age of 18 with disabilities to participate in leisure and social activities. Our third goal was evidence-based practice and clinical reasoning. This goal synthesized clinical reasoning and judgment in nursing practice using critical thinking, nursing process, research, and evidence-based practice. This was accomplished during Course 4390, Nursing Inquiry and Evidence-Based Practice via group project on the subject of nurse burnout. This was a quantitative research project that focused on how to organize nursing research, focusing on the research question, purpose, hypothesis, conception and theory, method of proposed research, and collection and measurement of data. This course was and is a cornerstone of how I feel I effectively complete research in all my other nursing courses. I now understand and appreciate how to look for, comprehend, and discard sources based on the knowledge gained from this course. Next was patient/client-centered care. The goal of this objective was to employ safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patients and clients and members of the interprofessional and intraprofessional healthcare team. Course 4540, Practice of Care of Communities, met this requirement in numerous ways. First, a video presentation was prepared on the subject of disaster preparedness. The subject I chose was how to prepare families for disaster if they have children younger than 10 years old. The course also included discussions on how to educate patients about potential health threats in their area. The topics range from water pollution to malaria and tuberculosis. In doing so, it allowed students to research not only who would be most affected by these diseases, but the resources available, no matter where they were affected worldwide, should those problems arise. Finally, we focused on the professional roles. The goal for this objective was to differentiate multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients or clients as a member of the interprofessional and intraprofessional healthcare team, demonstrating professional integrity, effective communication, active inquiry, and service to the community. This objective was captured in 2 courses for me. Course 4550, Nursing Leadership and Management in the Healthcare System, where students were challenged to write a paper regarding effective leadership and what it means in nursing. And the second course, 4620, Care of Adults with Compromised Multiple Health States. Students were asked to complete an assignment that allowed us to work with other disciplines in our environment, i.e. physical or occupational therapy or respiratory therapy. This was done through interviewing a patient with cervical spondylosis. While working with the healthcare team, we created a plan of care that included educating the patient about the disease and how they could manage it effectively on a holistic level. Finally, I'd like to conclude by giving you my 5-year career plan. My plan includes me spending the first 2 years honing my clinical nursing skills. Working in a skilled care facility, I don't have the option to do that very often. I would like to continue with bedside nursing with the goal of moving towards case management after the 2-year period. Then I would like to continue my education and become a nurse practitioner with a focus on geriatric health. That concludes my 5-year plan. Thank you so much for your attention. I appreciate it.